Today we're wrapping up hypertension, which is high blood pressure. So just think high tension on the arteries and vital organs. Now, normal BP is 120/80. Systolic is on top and diastolic is on the bottom. So our memory trick is San Diego. Systolic is the squeeze and expansion of blood vessels under pressure. And diastolic is that decompressing, that relaxation of the vessels. Now in hypertension, we have high tension on the heart and blood vessels. So remember, by saying anything over 140, the heart says, oh lordy. Now as far as your numbers, the elevated BP starts at 120 to 129/80. Stage 1 hypertension is 130 to 139, and diastolic is 80 to 89. Now we start taking major note when it gets to stage 2, this 140/90. Remember, 140, the heart says, oh lordy. Now hypertension crisis is anything over 180 systolic and 120 diastolic or more. Now this is super dangerous because it can cause brain damage and even a heart attack. Now as far as the signs and symptoms of hypertension, hypertension usually doesn't cause any signs or symptoms. Since it creeps up over time, we call this the silent killer. Now if there are signs and symptoms, our 3 most common signs and symptoms on Select All That Apply questions, and even on the NCLEX and nursing exams, use the acronym ABC. A stands for achy head or headache, and this can lead to a CVA stroke. B stands for blurred vision, also called retinopathy. And C stands for chest pain, which can indicate a heart attack. Now again, severe hypertension is called our hypertension crisis. It starts with anything over 180 systolic and 120 diastolic. Now it's an emergency crisis since it can kill the patient and destroy the 4 main vital organs: the brain, the heart, the lungs, and the renals, basically your kidneys. So we give IV drugs immediately. So remember B, C, D, and E. B for beta blockers, that puts the brakes on the heart, slowing it down. Our C is for calcium channel blockers. Remember, calcium calms the heart and controls the blood pressure. D for dilators, like vasodilators. So remember, D for decreases the blood pressure, because remember, nitro acts like a pillow for the heart. Rest and relaxation. And lastly, E is for ER to ICU, since it's a crisis situation. Now for our causes, think hypertension, high tension on the heart and blood vessels. So we use the acronym SODA, like high pressure from a shaken soda can. S is from stress, smoking, and this sedentary sitting lifestyle. Our patients get very narrowed blood vessels, making them stiff. O is for obesity, and oral contraceptives, aka birth control, can cause hypertension. Now D for diet. The causes are usually high sodium and high cholesterol, since sodium retains water in the body, causing high fluid pressure. And cholesterol sticks to the blood vessels, which narrows those vessels, causing resistance. Now D also means diseases, which we use the acronym Dr. H. Diabetes, which turns blood into mud from high sugar. Renal disease, which keeps fluid in the body and not in the potty. And especially heart failure. Again, fluid retention from a broken heart pump. Oh, and lastly, high cholesterol. Anything over 200 for cholesterol, aka hyperlipidemia. And lastly, the A in our SODA acronym, A for African American men and old age. These guys are both factors to increasing the risk. Now for complications, all this high tension from hypertension will destroy the arteries and organs. So we use the acronym again, ABC. A is for atherosclerosis, which I call artery scarosis. We have stiff, hard blood vessels from plaque buildup. Our second A is for aneurysms, which are bursting or bulging blood vessels. B is for broken kidneys, eyes, nerves, and heart. Broken kidneys is called renal failure. Broken eyes is called retinopathy. Damaged nerves is called neuropathy. And a broken heart is called heart failure. Lastly, the ultimate complications, which usually leads to death. C for clots. So guys, remember, a clot in the brain, this is known as a CVA or a stroke. A clot in the heart, we call it MI or even a heart attack. And a clot in the lung, we call it a PE or pulmonary emboli. Now for imaging for hypertension, we're mainly looking for a big enlarged left ventricle. We call this left ventricular hypertrophy. So guys, think big, hard, trophy-sized heart. So we'd use a chest x-ray to measure the size of the heart. We can also do an echo to see also the size of the heart and to measure the amount of blood being pumped out of that left ventricle, something called ejection fraction. Now, normal is 55 to 70%. Anything below 40% usually indicates heart failure. Now, as far as the cardiac monitor, our ECG and EKG, we want to see if the patient has tall R peaks, big R peaks means big ventricular size. And lastly, a little side note. It's not imaging, but little rule of thumb. 3 blood pressures 1 week apart is what the provider needs to officially diagnose hypertension. And that usually is a big test tip right there. Now, as far as blood labs, again, we're mainly looking for a big left ventricle, as well as risk factors leading to hypertension. So we use the acronym BCC. B for BNP, known as brain natriuretic peptides. They measure the wear and tear on the ventricles, and they kind of show how much stress and enlarging they're going through, aka ventricular hypertrophy. So 100 and less is normal, 300 is mild, 600 is moderate, and over 900 is considered very severe. Now C is for our C-reactive protein, which shows total body inflammation, not really specific to cardiac inflammation. And lastly, C stands for cholesterol panel. So think C for clogged arteries. Cholesterol clogs the arteries. What we really want to see is if the patient has risk for plaque buildup on the coronary arteries, the little oxygen tubes that feed the heart muscle. These numbers are huge on exams, so guys, please make sure to memorize these. 200, 150, 100, and 40. All numbers are bad and should be low, except this last one. 40 should be the only high one. This is our HDL, our happy lipids. So guys, total cholesterol has to be under 200, triglycerides under 150. Our LDLs are loser lipids under 100, and our HDL is the only one, the happy lipids, over 40. Now, a last little side note for cholesterol. All the bad cholesterol is obtained by only eating animal products, like meats, eggs, dairy, etc. But guys, fruits and veggies do not add cholesterol to the body. Huge test tip right there. Only animal products can clog the arteries. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos.